Yellow vision, lack of appetite, or bradycardia. Are you familiar with them? The medication that can help your patient with heart failure. The same medication can lead to dangerous cardiac arrhythmias. It's important you don't miss the cues. Hello everyone, it's Nurse Mo from Pharm NCLEX Academy. Let's talk about digoxin, how it works, why it's given, and signs of toxicity. Digoxin is a cardiac glycoside. It is used for heart failure and atrial fibrillation. Digoxin works by increasing cardiac contractility. In heart failure, the heart is unable to pump enough blood to the rest of the body. Cardiac contractions are weak and cardiac output is low. Digoxin is a positive inotrope, which means it increases the force of cardiac contractions. So, when digoxin is used in patients with heart failure, the result is improved cardiac output. Improved cardiac output will help to reduce the symptoms of heart failure like fatigue and shortness of breath. But that's not the only thing. Digoxin also slows down the heart rate. Think about it. In heart failure, the heart is weak, but it's beating fast to catch up on what it's supposed to do, and it's still not able to do it very well. With digoxin, instead of a fast, weak, and inefficient heartbeat, the patient will have a slower, stronger, and a more effective heartbeat. That's why digoxin is very helpful in heart failure patients who also have atrial fibrillation. And remember this for your exam. Before giving digoxin, check the apical pulse for 1 full minute. In adult patients, if the apical heart rate is below 60 beats per minute, you should hold the medication and contact the doctor. Check digoxin level. The therapeutic range is narrow. Also look at their kidney function and potassium level. Monitor the patient closely for signs and symptoms of digoxin toxicity. Anorexia, nausea, vomiting, and diarrhea in a patient taking digoxin must be taken seriously, as well as bradycardia, dysrhythmia, and visual disturbances, because these are signs and symptoms of digoxin toxicity. If you are a patient taking digoxin, take it at the same time every day. If you have diarrhea, nausea, or visual disturbances, contact your healthcare provider very quickly. Here are some practice questions on this lesson. Question 1. The nurse is caring for the following patients. Which patient should the nurse assess first? Answer choice A. Patient with heart failure reporting mild fatigue. B. Patient taking digoxin who reports nausea and blurred vision. C. Patient with blood pressure of 132/84. D. Patient requesting pain medication for a chronic back pain. Which of them will you select? The correct answer is B. Patient taking digoxin who reports nausea and blurred vision. Here is the rationale. Nausea and visual changes in a patient taking digoxin indicate possible digoxin toxicity, which can quickly become life-threatening due to cardiac dysrhythmias. This patient requires immediate assessment. Question 2. The nurse is caring for a 42-year-old patient who is taking digoxin for heart failure. Which of the following actions demonstrate correct nursing practice when administering digoxin? Answer choice A. Check radial pulse for 15 seconds. B. Administer with antacids. C. Hold the medication if the apical heart rate is below 60 beats per minute. D. Monitor sodium levels before administration. Which of them is your choice? Correct answer is C. Hold the medication if the apical heart rate is below 60 beats per minute. Here's the rationale. The nurse must assess the apical pulse for 1 full minute. The nurse should also hold the medication if the apical heart rate is less than 60 beats per minute in adults. The nurse should count the apical pulse, not the radial pulse. Answer choice A is not correct. Antacids will interfere with the absorption of digoxin. Answer choice D is not correct also because potassium is the critical electrolyte, not sodium. Thanks for watching and learning from this video. If you want a more NGN-focused NCLEX prep, our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that's built specifically for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like, share, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.